Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Okay, we are back right here on Healthy Living Tuesday on KUM News Extra, and Dr. Jitka Lom from Express Care is joining us tonight. And for our education and our edification, the good doctor is teaching us about the thyroid gland and exactly what it does. And as we've come to understand, doctor, you know, the thyroid, a pretty intelligent piece of hardware in our body, for lack of a better term.
It really is. Without it, we would die.
Okay.
Yeah.
Okay. Okay. And then
yeah.
Just like that.
Just like that.
Okay.
Yeah.
So as so many things in the body. Okay. So here we are to our Facebook questions. You, of course, out there in TV land and online, post these on our Facebook wall. You ready?
Yes.
Okay. First of all, Jen Taitingfong asks our first question, and she says, Dr. Lom, I eat right and I exercise all the time, and I have not lost any weight. Could this be my thyroid?
Yeah, it's a great question, Jen. It could be your thyroid, and it's an easy thing to check. You just need to go to your doctor and get a simple blood test done. You need to ask specifically that be tested for. Screening tests sometimes aren't adequate. You need to do the specific test for thyroid function, and you may have that trouble. So it's good to check it out.
Well, are there any like home remedies that you as a physician can recommend, or like people checking whether it's maybe swollen or if it's hot or if
That's a good question too. If your thyroid is very enlarged or if it's lumpy, you can sometimes feel it, but you have to be usually trained to feel it. It's quite a subtle thing to feel. Okay. But sometimes if somebody has a very large one, it'll be obvious, and it'll be hard for them to even swallow.
Yeah, it's right next to the throat and the esophagus and everything, so that'd be a little weird. Okay, question number 2 says, I have been on thyroid medication for about 5 years now. When can I go off the meds? And doctor, this comes from Anne-Marie B.
Okay, well, you know, Anne-Marie, it just depends on what kind of thyroid problem you have. If you're hypothyroid, chances are you'll be on that medication for the rest of your life, and you should not stop it suddenly without checking with your doctor or getting some blood tests done. Sometimes, though, people are on thyroid medication to reduce their hyperthyroidism if it's overactive, and occasionally those medicines can be stopped. But it's something you need to do with your doctor's advice.
In terms of extreme medical conditions, is it better or worse to have a overactive thyroid or a underperforming thyroid?
Well, you know, neither one is very good, really.
Dangerous either way?
Not so much dangerous, but really impacting the quality of your life.
Okay.
So feeling very tired and weak.
As opposed to like just being...
And having energy.
Okay.
Yeah. All
right. So question number 3, once again, you can go to our Facebook wall anytime and ask a good doctor a question. This one from KUM.com/Facebook says, Doctor, my grandmother and my mother's sister both have thyroid troubles. Should I be concerned? So this comes back to the theme we always have here on Healthy Living Tuesdays about hereditary diseases.
Yes, and thyroid problems do run in families. Again, last time we talked about autoimmune conditions where your own body attacks itself, and that happens in hypothyroidism sometimes, where the body has suddenly found the thyroid to be an enemy and is destroying it slowly, and your thyroid function decreases, and that does tend to run in families, so it's important to check it out.
Okay, so and if anything is in 2 or more members of your family and everything, you might want to pass by Express Care and just say, hey, you know, this is my history, can you give me a look?
Yeah.
Okay. Our second to the last question is from Concerned from Maurizo, an anonymous person, and this person asks, Doctor, at what age should I get my thyroid checked, and what type of tests are run? That's an interesting one.
It is a good question. If you're having no symptoms at all, at your annual health exam, your doctor may run some blood tests and a screening test for your thyroid gland. But as you get older, you have more chances of developing a lower thyroid function, underactive thyroid. And sometimes it's very subtle. Elderly people might just be depressed or kind of slow, and it might be attributed to their age. And it's something that can easily be checked with a blood test. On the other hand, if you're having a lump in your thyroid, then that needs to be checked with an ultrasound. So usually we start with blood test and ultrasound to check out thyroid function.
So pretty standard fare. You're not going to be excessively poked and prodded.
No, very easy.
Okay.
Yep.
Well, last question comes to us from someone called No Name. I think I may know this person. And this person asks, I have an overactive thyroid. Is surgery the only way to take care of it? So this goes a little bit, you know, more sensitive treatment.
Yeah. No, sometimes the thyroid gland will burn itself out if it's overactive. This is another immune system problem called Graves' disease. It can burn itself out gradually over time, just controlling the symptoms with medication. And other times, the thyroid gland needs to be destroyed with radioactive iodine. So the person actually swallows a tablet of radioactive iodine that goes into the thyroid gland, destroys it completely, And that's it for the thyroid gland. They have to be quarantined away from other people for a few days while they're having that therapy, but it avoids surgery. Yeah.
Okay, so that's an interesting solution, or an option to a
Yes.
solution that someone may want to take.
Yeah.
Okay, well, really interesting conversation. Doctor, as always, a real pleasure to have you here.
Nice to be here. Thank you.
Okay, we look forward to next Tuesday again, when
Thank
we will
you.
be talking about headaches. So make sure everybody out there, get your questions on our Facebook wall at KUM.com/Facebook, because headaches, certainly something all of us have here. We'll probably talk about, whether the weather conditions have them. And we also want to tell you about the possibility that you could win a free Botox treatment. So make sure to go to KUM.com or our Facebook wall and find out about that. We want your feedback, and we want to feature you right here on Healthy Living Tuesday. As for tonight's show, another break coming up, but we will continue right after this.